Learn about health from within on the Phenomenal Health Show with Dr. James Ryan Finn.
One of the things people come in all the time and they're like, don't crack my neck. Mm-hmm. And when you hear that, there's probably a reason. Anybody that's leery to get adjusted, there's probably a problem in there and they just innately are guarding that. Mm-hmm. You know, if you ever have a sore thumb, like you kind of guard it and you make sure you're careful not to.
Yeah.
People guard when there's something wrong with their spine too, which is why we do a very detailed exam to make sure it's safe. And when you find something in there, like you got somebody that's got phase 2 degeneration in their neck or phase 3, or even they've had surgery and there's plates in there. You don't just go lay them on the table and rip and grip that thing and see how hard you can get it to crack. In fact, quite the opposite. It's trying to figure out what the cause of it is and what caused that. If you've got bolts in your neck, something caused that. Some type of biomechanical dysfunction got so bad that you needed surgery. So, and also to a lesser effect when people are just guarded on their neck, and the adjustments that we do are very, very gentle. I adjusted, I think they're 2 months old now, 2-month-old twin babies yesterday.
Oh.
When that mom hands me that baby, you think I'm going to get that kid. How much can we get this thing to crack?
Right. Yeah.
So, but the little baby, their belly was all distended, and there's a little technique you do in the belly, and then it gets loose, and you can kind of work on the guts a little bit, and you work on the spine back there, and then,
you can tell it gives them relief.
Oh, they just melt, and I hand it back to the mom. She goes, I can tell there's a difference already.
Really?
It's just the funnest thing to adjust
cool.
the babies. They respond.
It's got to be kind of a nervous thing for you to do, though, right?
No.
With a
it's
newborn?
my joy.
That's cool. That's cool.
Of course, when you're brand new, and I've been doing it for 25 years. I've done 350,000 adjustments. I don't know how many infants.
There you go.
No, I look forward to it all day. When you see them on the schedule, I'm just all jacked up. And I can't wait. Because you can help them. It's instant. But by the time you're 50 years old and you've slept on your side for 50 years and you're sitting on a day job looking at a screen all day, you don't think your spine's messed up?
True.
It takes a little longer. Obviously, my 17-year-old pro motocrosser that I've got doing his first pro race this weekend, we're super excited about to watch. Carson Wood, go for it, buddy. That's the guy's going to respond a whole lot faster than my little old ladies from Crawfordville. Okay, so I don't know. People are sometimes leery about it, maybe, and people, you do grounding and supplements and peptides and red light therapy and organic food and fitness trackers and saunas and breath work, but then they won't come get adjusted. And it's just, I don't know. Some people maybe safety. A lot of people don't want to find out what's wrong. You just don't want to know, So maybe somebody had a friend tell them a scary story. We get those from time to time. Oh, I knew one time. I had a radiologist one time. Oh, and we've seen all the problems from chiropractors as a not a radiologist, as an X-ray tech. Really? Have you physically seen that? No, someone told me. Yeah.
A friend of mine.
How many X-rays have you taken, in your career?
Right.
Like the biggest one that's super scary is a vertebral artery dissection. Like basically, there's an adjustment called the rotary brake, which you turn the head as far as it can, laterally flex as far as it can, and crack. And I've never done that technique, but that technique mostly done, more often people are injured by that technique by osteopaths and medical doctors that do it, believe it or not, than chiropractors, because we do a detailed analysis, and it's not necessary when you have decent skills to adjust somebody, not just trying to crack a neck. But if I was to do that technique on every single patient, I would have to practice for more than 800 years before it would happen in my office.
Really?
And you've got Gary Null's Death by Medicine that shows that correctly given prescription medication kills more people every day than heart disease or cancer.
No doubt.
But chiropractors injure one people and it's major news. So it's just, and it's awful. You don't want anybody to be injured. Like, it's very, very rare. And there's a whole industry whose job is to assign dollar value to risk. What would that industry be?
Insurance.
Yeah. What do you think my malpractice insurance is compared to your general practitioners?
Probably not a lot.
Yeah, way lower. What do you think it is compared to your dentist?
Really?
Way less.
Is that right?
Huh. Sure. There's medications involved. Medications are inherently risky.
There you go.
So, that's it. When they're doing shots and pulling teeth and there's risk of infection and all that. And dentistry is very, very, very safe, as is medicine done properly. But, there's a risk to the drugs thing. So
statistically, there must be less injuries with chiropractic.
Radically less.
Yeah.
It's rare. I mean, it's one of the safest, most conservative, most natural forms of healthcare. Certainly, as a licensed physician in the state of Florida, we're the safest. We are licensed physicians, like your PTs are doctors, but they're not licensed physicians. Your acupuncturists, your massage therapists, like none of them are licensed as physicians in the state. DOs used to be like chiropractors. They would manipulate. And when we do the rule of the old school turn of the century stuff, we were the rule of the nerve. We're trying to take pressure off nerves. they were the rule of the artery, and they would manipulate to get pressure off the arteries. And the nerve thing, and our analysis got deeper, and we became chiropractors that primarily check the nervous system so we can get it better functioning. Or DOs really became absorbed in medicine. They may function very much like an MD, but they also do doctor of osteopath. They may also do osteopathic manipulation, which is different than a chiropractic adjustment. And I've never experienced one, but sign me up. If there's a DO out there that's listening that wants to swap some care, I'd love to be adjusted.
What is osteopathy exactly?
Well, that's it. The rule of the artery. They would
rule of the artery, okay.
But they don't practice like that. Most DOs that I know that practice very similar to medicine, they've been absorbed by medicine, practice as medical doctors, and are licensed to prescribe and treat with drugs and things.
So if somebody had texted me like right before you started and said, I'm afraid to get adjusted, never have.
Yeah.
I hope that they listened.
Fair enough.
There you go.
And I get it. It's a little scary. There's a lot of trust, but our process, we've developed a phenomenal health exam, but it's so detailed. I mean, we take time. We just don't throw you on the table and just, there are places that do that. Like somebody was telling me they had a chiropractic at the airport. You can just stop in and get adjusted. Okay. They have it at truck stops. They have the Palmer School of Chiropractic one time had them, maybe it was Life. One of them chiropractic schools had them in truck stops because those truckers are, where we go by the Sing store every week. That's their route, even though they may travel 900 miles. But anyway, you could go to things like the Joint, which we don't have here, but they go and you just go get an adjustment. There's no x-rays. There's very little evaluation. And I can do that. I've adjusted whole soccer teams and taking care of teams, and you don't do x-rays, but you do, an exam and make sure they're safe. You can safely adjust people, but in our office, we don't do that. We do a detailed case history. We do bilateral weight scales, which basically 2 bathroom scales, and you put one foot on one on the other. Should they be the same?
Yes. Yeah, I think so.
Oh, yeah.
Right.
We have posture checks that we do digitally to measure that. Of course, a case history. What have you been through? Oh, you rode horses as a kid. Huh? Ding, 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 ding. Things like that. I played softball, multiple spinal traumas, football, anything. I used to ride motocross or, as a swimmer, or I read a lot. I love to draw. Those are people that sit a lot. So we do a detailed case history, and that's where you get a lot of information to figure out, okay, they've been through any traumas. But then also x-ray. We just got brand new. We got it 3 weeks ago. State-of-the-art digital stuff and for our x-ray equipment.
I heard you talking about that on the phenomenon.
Really?
Yes, it is.
What kind of stuff does it show you?
Just more clear, better. The technology gets better and better. And when you invest in new technology with the x-ray, it's just super crisp, super clear. You can see every little thing. I can back it off a little bit and see the hair on your head.
That's cool.
But
nice.
We want to see those. Obviously, any and every healthcare intervention carries some risk, okay? Like medicine, surgery, even over-the-counter medications. There's 50,000 people go to the hospital every year from gastric bleeding caused by aspirin. Doing nothing has risk too, probably bigger. So, living with that just spinal stress, your posture's all jacked up, your range of motion's off, and your nervous system interference has consequences. The average person waits until pain happens. It's just who shows up at the chiropractor, right? But that's typically the last symptom. The symptoms are the last thing to show up. And the good news in my profession, the first thing to go away. People feel better, but you don't just have a heart attack. You don't just get cancer. You're sick for years and then you have a heart attack or get cancer. The same thing with your neck or back pain. Like you've got degeneration and old dysfunction and old dents and dings in there. And the real question is, not do you have pain, but how well is your body functioning? And some of the things you can know on your own without getting checked, like, can you turn your neck? Okay, can we go the same distance? Look at your kids. Like, can they turn their neck? I was backing my
car up yesterday and thinking of you, like, oh, that's all my ROM.
Yeah. Do you sleep well?
I sleep fantastic.
Yeah, good. Like, can you breathe deeply? Can you take that biggest, deepest breath?
Yeah.
How does your nervous system adapt to stress? Do you feel stressed out all the time?
No.
Can you move without stiffness? When you stand up, is it like, ugh? Do you wake up energized? Are you aging well compared to people your same age?
Good question.
Health is not just about the absence of symptoms. It's about function, and your structure matters. Your spine protects your nervous system. Posture affects breathing mechanics, circulation. The nervous system is all about balance and resilience, and that's what we do. We balance that. So, there's super cool research on what chiropractic does. It gets geeky, like heart rate variability. That's how well you're adapting to your environment. You measure how quickly your heart rate is varying throughout the day, throughout the minute, throughout the seconds. And you know that you're adapting your environment. That's a measure of adaptability. That gets better when you get adjusted. Blood pressure is typically lower. They did a big double-blinded controlled research, holy grail of all studies, with chiropractic, the chiropractic atlas adjustment, which a lot of chiropractors don't do a specific upper cervical chiropractic analysis. Dennis Fiorini, John Dunn was a master. I do an upper specific, even though I do full spine, I do a specific upper cervical analysis on everybody. That one type of adjustment lowered blood pressure better than 2 medications given at one time.
Is that right?
Yep.
Really?
But, your athlete's reaction time, your visual field, you can see more to your sides while you're looking straight ahead after getting adjusted.
And you need that in sports.
Sure you do.
A peripheral.
My motocrosser is like, what do you want? You want to see behind you? Like by looking straight ahead. So you would like that, but it can get you a little more sideways. But your balance, muscle activation, quality of life, function, just function. And guy, Dr. Dan Murphy, lectured extensively on research of the autonomic nervous system and changes, but people don't want that. They just want to feel better, sleep better, do better. They want their body to function like it's supposed to. You want to be 90 something years old and be able to get off the dang toilet.
Right.
So,
planning ahead.
The side effects are often with medicine very dire. Have you ever listened to a commercial and heard the side effects at the end of a drug commercial?
God, yeah. That's
Suicidal
half the
thoughts.
Commercial.
Yeah, it is.
Suicidal thoughts and genital necrophilia, where it dies. I don't know what it is.
Uncontrollable bowel movements.
Yeah. Well,
All for your rash.
Right. What?
typically you come in for chiropractic and it's healthier movement.
Mm-hmm.
The side effects are better posture, improved mobility, stress relief, relaxation, and greater sense of well-being. In chiropractic school, you adjust the students first, you adjust each other, and it's all controlled. You have to write the plan up and run it by the attending doctor, and they approve and come and watch, and you figure out what adjustments you're going to do. But the first person I ever got let loose on in the general public was Diane. Okay, Diane was a nurse, and Diane was every bit of 400 pounds. She was a big lady and spectacular woman. We loved her. She was a dear family friend, which is the only reason I talked her in to come get adjusted. But I did a specific upper cervical analysis on her. I got her down. I did a toggle recoil adjustment on her atlas, and she stood up and she said, "Wow, I feel lighter." I'm like, this stuff works.
Wow. That was your first patient?
First real
Oh,
patient,
wow.
Spartanburg, South Carolina at Sherman College.
Neato.
But people say they breathe better. They say, I didn't realize how tight I was. I feel calm. And, the fear of getting over it, the fear of the unknown, the fear of hearing bad news, the fear of the crack, whatever they're scared of, we're very, very careful to walk people through that first adjustment. You just don't throw them on the table and like, what just happened? Okay, here's what we're doing. I've got your x-rays up. We're checking your leg length. I'm going to palpate your spine. We're going to feel where it's moving. We're going to see how that goes with the x-ray. There's 6 checks I do in a few seconds, but you explain that to the patient. Okay, I'm going to have you breathe in and breathe out. Sometimes we'll hear this, a little pop or a crack here. Sometimes not. If you don't hear it, like, well, I'm disappointed. What was supposed to happen? We get you through it. If there's a reason why you don't want to be adjusted or you're scared of it, that means you need to be checked. You have something innately that tells you something's wrong, and ignoring it is bad news.
FENNCHIRO.com. Remember, your chiropractor loves you.
And there's nothing you can do about it.
Nothing.